I work at Middlesex Health in Middletown, Connecticut. I am the medical director of our Middlesex Health transgender medicine program. And so I'm a division of endocrinology. So I do a lot of hormone therapy, a lot of diabetes. And then as my role for medical director, I oversee the entire health system, making sure that we are providing the services that are needed in the community and making sure that everybody is trained, everybody from the CEO all the way to our volunteer services, security and environmental services, making sure that we are taking care of people in the best way possible, and that includes the trans community. So I put together a couple of slides. I really am here mostly to foster a conversation, so I don't want to take up the entire time just talking at you. I really hope that you'll sort of consider what I'm saying and come up with any questions. There's nothing off the table, though I do ask that you're respectful. So the first slide that I always share is this one. It's a quote from Arthur Ashe, and he says, "Start where you are, use what you have, and do what you can." And I think in trans health and gender issues in the world, I think that's incredibly important. And you can take that all the way across everything we deal with in the world. But really, I think the biggest barrier to making a difference in the world or exploring something different is that we all sort of have this innate feeling like we don't have the skills that we need. So I'm going to give you some skills today to talk about gender, and I would really encourage you to think about gender in your world and how that affects you, and in whatever way that you can to expand your knowledge and practice using the vocabulary and see how you can understand the world in a little bit of a different way. So the other two quotes that I like to use when I'm sort of framing what we're going to talk about are these two. And one is from a poem, and this is just a tiny bit of the poem where it says, "Fear is the cheapest room in the house. I would like to see you in better living conditions." And I really do think that when we start from a place of fear or misunderstanding, then we tend to not make good decisions, and we tend not to be kind to each other. So so this is just a way to think about maybe starting from a place that's not so much based in fear. And the other one is from an author that I really love. And she says, "The problem with stereotypes is not that they are untrue, but that they are incomplete. They make one story become the only story." And so this is so apropos to gender, because we talk, stereotypes are not untrue. Stereotypes really are true in a lot of ways. People who have estrogen tend to cry at cotton commercials, whereas people with testosterone tend not to. But if you think about that and you make it the only way that a person can be, then you've missed their personality and you've missed some things about them. So I use this quote just to get us into a space where we're thinking about sort of expanding our knowledge and really thinking about things that we know and maybe things that we don't know. So this slide is really important. It goes to the crux of what gender means, especially in our here and now. So in the United States, we do not do a very good job of using vocabulary words in this realm very well. So these are the words that you really need to know and know them well. So the first one is the word sex, and the word sex and gender, we tend to conflate in the United States. So we think they're the same thing. But in reality, they're two very different things. So sex is what we consider what you were assigned as at birth. So something like when you're born, they look at your genitals, they say it's a boy or they say it's a girl. And this is really based on your biological chemical makeup. So whatever genes you were given, whether you were given XX chromosomes or XY chromosomes or some combination, and your body then made hormones and then built specific structures. And then so when you build your genitals a certain way, you're given that designation. So, but gender is a little bit different. For many, many people, sex and gender are the same thing. If you're born with female genitalia, you identify as female, you go about your day, you're good to go. But gender really is sort of how we understand ourselves in the context of our culture. So culture is different across all different states, across different parts of this country, across the world, and across time as well. So if you grew up in the early 1900s versus the early 2000s, our culture has very different ideas about gender. So as you're growing up, you sort of develop this idea about how you fit into that. And for many of us, whatever we were assigned at as birth, we fit into. So, for example, I was born with genitalia. My gender identity is female, and so for me, those two things are the same. But for some people, what they were assigned as at birth does not match how they experience their gender in our culture. I put sexual orientation on here mostly to explain that it's not the same thing as gender. A lot of people assume that gender and sexual orientation are the same thing, and it's just that we misunderstand how genitals and gender identity are intertwined. So sexual orientation is not an internal identity, whereas gender is. So gender is how you understand your own internal identity, whereas sexual orientation is a label that's actually placed on you from the outside world. So my gender identity is female. My wife's gender identity is also female. And so the outside world labels us as gay or lesbian. Now, if one of us had a different gender identity, say she transitioned to male, her new gender identity is male, and now we're still in the same relationship, we're still interested in the same person, the outside world would change our identity to heterosexual or straight. So you sort of experience sexual orientation through your gender identity, but the two are not the same. A good friend of mine, who some of you may know, Tony Ferriolo, always says, gender is who I go to bed as, and sexual orientation is who I go to bed with. So two different things, very closely aligned. The other important thing about this picture is that everything is on a continuum. Gender identity, sexual orientation, and even biological sex can be on a continuum. So this idea that you are set in one and you cannot move is outdated. Most people experience their gender in multiple different ways. So most people have some of them as feminine, some of them as masculine, and that what is considered feminine and masculine is often different in different parts of the country and also in time. The one example I always use is a man bun, right? So 100 years ago, man bun was normal. It went out of style. It started to be more on the feminine scale, and now it's sort of back. Now man buns are a thing, and it's okay to be masculine and have one. So things change over time. I have a 13-year-old in the background who may have his own opinion about what I'm saying. And then a couple of other vocabulary words to keep in mind. The word transgender is just an umbrella term that we use to sort of encompass anyone whose sex assigned birth and gender identity do not match. It really encompasses many, many things and can be used in lots of different ways. The word non-binary means that someone doesn't necessarily associate themselves with either male or female, or they might associate themselves with both male and female. So the idea of a binary is really just that there's two, I call them boxes. We have the female box and the male box. And in the culture in the United States, that's pretty much what exists. You have those two boxes and you're supposed to fit mostly into one of them. So being non-binary means that you either fit into neither box or you sort of fit into both boxes. Gender nonconforming is this idea that you don't necessarily fit into your box. And I would posit that we are all gender nonconforming in some way. So, I wear pants to work every day, and that is less gender nonconforming now than it was in the past, but it's still one of those things that's outside my normal. It's socially acceptable, but it's gender nonconforming. So someone who identifies as male that has long hair or wears dresses, that would be gender nonconforming. But all of us have something that's gender nonconforming. So this idea that we don't understand other people who are gender nonconforming is kind of a non-starter. If you really start your day and think all the way through your day about things that you've done or worn or ways that you express yourself, I think you'll find that a lot of what you do is also gender nonconforming. Gender dysphoria is the term that we give people for whom their sex assigned at birth and their gender identity are different, and that discordance causes some manner of dysphoria, some inability to reconcile those two things. And so not everybody who's transgender has gender dysphoria. Some people are perfectly happy in their gender identity and it doesn't bother them at all living in the skin that they live in. But for a lot of people, the difference between their sex assigned at birth and the expectations that come with that, and then also the ways that their body has formed, those cause significant dysphoria with how their internal identity has formed. So, one way that I think about all of this, in our culture, we've sort of done this thing where we assume that people who have gender dysphoria have done this to themselves somehow or are crazy somehow. And so the example that I always give is in medicine in general. So the other, diagnosis that I spend 99% of my time doing is diabetes. And when someone comes into our office with diabetes, we almost never say, well, why did you develop diabetes? That was not a smart idea. And that person did not certainly wake up that morning and say, you know what I'm going to do today? I'm going to develop diabetes. That sounds like a really good time. So in most of medicine, your brain says one thing. So in this example, it's, I'm not going to have diabetes. And your body says something else. In this case, it says, well, your glucose is high, so now you have diabetes. In gender dysphoria, we do this weird thing in our culture where we do it backwards, right? We say if somebody was born assigned male at birth, right? We assume that the body was formed correctly and the brain, the gender identity of being female is incorrect. Whereas that should be backwards. What the brain said was that the person was female and then the body did something different, just like it does in every other disease state. So if you flip that on its head a little bit, it's a little bit easier to explain to people. The word trans man is someone who is assigned female at birth and identifies as male or masculine. And a trans woman is someone who is born male at birth or assigned male at birth, and the gender identity is female or feminine. So the way that it's easy to remember it is you're always talking about the gender identity that the person identifies as or is going to, not where they're coming from. The words passing and stealth are words that are used primarily in the community about how you can, how well you do in public being gendered correctly. So passing or stealth is me going out into the world and I am able to be gendered correctly and no one questions my gender identity. So someone who's passing can safely move about the world. That is a really important thing for people who are trans, particularly people who say were born male or assigned male at birth and are having a difficult time being gendered correctly in public. Being stealth is a different term along the same lines, meaning that you pass so well that you don't have to tell anyone except your closest romantic partners that you are that you're trans or transitioning. And this is, something that has been brought up in medicine as being, providers who are not trans friendly will say, well, that's lying. They shouldn't be lying. And I would say that in the same way that all of us are gender nonconforming in some way, all of us are stealth in some way. None of us walk into a room and introduce ourselves and then give a list of the surgeries that we've had. There are just some things that people in public just don't need to know about you. And so being stealth is a way to just be safe because violence against trans people is actually really, really common. It's actually more common this year than it has been in the past. And trans women of color are bearing the brunt of that. So being able to pass or being stealth is really incredibly important to actually surviving sometimes. And the most important thing about this slide is really just that gender does not equal pathology. Across all different kinds of animals and organisms, the idea that you're one set gender is not normal. Most organisms can float between different kinds, and this idea that there's something wrong with someone who's exploring their gender identity, I don't think there's anything wrong with that. So my favorite, everybody sort of refers to themselves as different, gender expansive, transgender, whatever their word they're using, but my favorite one by far is there was a 10 or 11-year-old who describe themselves as gender awesome, which I think is the best way to describe it. So I want to do just a minute on gender reveal parties, partly because they're my pet peeves in life, and partly to give you a way to advocate for everyone, really. So gender reveal parties are super popular, and I gotta be honest, they're adorable. I'm addicted. I can watch them all day long. However, there are a couple problems with gender reveal parties. The first of which is that there's a vocabulary problem. I work in endocrine, we're all super nerdy, so vocabulary actually means a lot to me. So when you're having a gender reveal party and you say, cut into a cake and it's a certain color, either blue or pink, and that tells you what kind of baby you're having, What you're actually having is a sex reveal party, because all you're revealing by doing that is the genitals of your baby. You're not telling somebody what their gender is going to be because they haven't experienced our culture yet and they haven't developed their gender identity yet. So if you're going to tell somebody you're having a sex reveal party, chances are they're not going to put it on Instagram, and they're probably going to take it down as soon as you put it up. So that's a very different kind of party, but technically it's the correct wording. So if you look on Google, you'll see a million different ways to do gender reveal parties. There's lots of money involved. My personal vendetta is really just that now one in Arizona and now one in California, some of the worst wildfires that we've had this year are related to gender reveal parties, where they set off some kind of fire device that had a color in it, and it set off an actual wildfire that made 20,000 people have to leave their homes. I put up different cards that people send. So your friend has a baby, you send a card that's pink and says, "It's a girl." You have no idea if that girl's actually going to like pink or not. And that pink really is just signifying that that baby has a vagina. So I always joke that I'm just going to start sending my friends cards that say, "Congratulations on your baby that has a vagina," but nobody but me thinks that's funny. And so I haven't done it yet. So as I was falling asleep last night, I had a brilliant idea for gender reveal cakes. When you cut into it and the icing inside is the color that tells you what kind of baby you have, I think all of them from here on out should be purple, because all of us have some pink in it, us, and some blue in us. These are the weirdest part, these lectures. This is the weirdest part, because I made the joke that's supposed to make people laugh, and then I can't hear anybody laugh, and it's kind of, only my 13-year-old who's sitting near me is laughing, and I'm pretty sure he's laughing at me and not with me. And then just thinking about de-pathologizing gender, that idea that gender does not equal pathology. Everybody experiences their gender through their body and their physical appearance, how their hair looks, what kind of jewelry they wear or don't wear, what kind of makeup they wear or don't wear, their clothes, their social interactions, what they call themselves, what pronouns they use. But ultimately, what the most important thing that we do is treat the human in front of us. And so when I'm teaching people who are medical providers or nursing staff, we really talk about really taking stock of who's in front of us and not relying on their gender or their sex assigned at birth to determine who that person is. So one of the easiest ways to show someone respect is to say, "What name can I use for you today?" Or "What is the pronoun you prefer today?" It doesn't mean that they have to have the same name and pronoun every day, but if you ask that when you're meeting somebody, it means that you're creating a space where you can respect them and their decisions. Because ultimately, I think where the discomfort comes is if somebody said to me, "Hey, Kevin," and I was like, "Sorry, my name is Katie," they feel bad that they've used the wrong name. But ultimately, the discomfort is mine, right? So you want to do everything you can to make sure that you're using the correct name and pronoun. And in medicine, we care what organs are present. Probably not in regular life, you wouldn't care that so much. But if you have somebody who's, say, transmasculine and they're having abdominal pain, you want to think about what organs are still in that person's body so that you're treating them correctly. Just because they're masculine, you don't want to not pay attention to the potential for pregnancy or having a uterus or ovaries, but you also don't want that to be the only story, and you don't want to act like that is somehow a problem, that transmasculine person has those organs. So it's difficult to know how many people identify as transgender in the world or in this country. You can't really do a survey, and you can't really ask with one single question, because if, say, somebody was assigned male at birth and took hormones and puberty blockers and really never lived as male and has always lived as female, that person may not identify as transgender. So you can't send out a survey to the whole country or say with the census and say, "Are you transgender?" You have to ask a series of questions in order to get to the answer that you're looking for. So, and also, trans people have not been treated well by the medical establishment historically, so it's really unlikely that you would get good data. So the Williams Institute does population data, extrapolating out from several studies. looking at different questions and trying to figure out how many people there are. So we think there's about 1.4 million people in the United States who identify as transgender. That was in 2016. It's been several years since then, so it's probably much higher than that. And part of that is just people's willingness to explore gender. Many patients that I see tell me that they knew something was different about themselves 30 or 40 or sometimes even 50 or 60 years ago, but they didn't have a word for it. They didn't have a way to explore it. There was no safe way to do that, and so they didn't think about it until now. So that number will change over time. In Connecticut, we estimate that there's over 12,000 people who identify as transgender. At Middlesex Health, we have about probably around 1,200 right now who access our system in some way for health services who identify as transgender. So even though we're one of the largest programs in the state, we still have only a tenth of the people that are in our state. Just a couple of things about history. Being trans is not something new. This is something that we've known about for hundreds of years. In the United States, the first time that we have a documented time where someone was treated with hormones for being transgender was in 1949, and that was Harry Benjamin in San Francisco. The first symposium was held 20 years later. And the first organization was called the Harry Benjamin International Gender Dysphoria Association. And that then changed to the World Professional Association for Transgender Health later. And that's the association that still exists today. In 1969 were the Stonewall riots, and my favorite t-shirt is the one that says the first Pride was a riot, because Stonewall was started by two trans identified females who were just fed up with being arrested for going to a bar in women's clothing. So that was the first Pride, and that's why we celebrate Pride in June every year. In 1987, the organization that puts out mental health diagnoses added gender identity disorder as a diagnosis. Of note, this is in the mental health and behavioral health realm, rather just in the medical realm. And that diagnosis has changed over time and is currently gender dysphoria. Both of those terms are incorrect for many people. People's gender identity is not a disorder, but we tend in medicine not to, insurances don't pay for us to see people who are healthy and don't have any problems, so we always call things a problem. So gender identity disorder has then morphed into gender dysphoria, which is what we use now, and it will probably change again with the next set of ICD-10 codes that we use. It wasn't until 2005 that California became the first state to mandate health coverage for trans people. And we do mandate coverage here in Connecticut as well. We are very, very lucky to have some incredible advocates in the Connecticut Trans Advocacy Group who really put themselves out there and do the work to make sure that all our trans patients are covered for services, both mental health, hormone therapy, and surgery. The Girl Scouts started in 2012, welcoming all children who identified as female into the Girl Scouts. In 2014, which is only 6 years ago, Medicare started covering gender-affirming surgeries. For 20 years prior to that, they said it was quote-unquote experimental, so they wouldn't cover it, but now they do. For most of it, it is still a struggle, and especially with the current administration, it makes it more difficult, but we are able to get some of the procedures that we need done. In 2014, Facebook introduced multiple gender options. And when I say multiple, I mean more than 20 different gender options that you can choose for your pronouns. And Google followed shortly thereafter. Not for nothing, but dating apps also do that, where you can identify your gender as something other than male or female. It wasn't until 2015 that a sitting president said the word transgender in a State of the Union address, and that was in 2015 with President Obama. In 2016, transgender people were allowed to serve openly in the military, but that was reversed in 2017 with President Trump. And just this year, earlier in June, before Ruth Bader Ginsburg passed away, there was a case before the Supreme Court brought by a trans woman who was fired from her job because she came out as female, and she had multiple health issues, and actually losing her health insurance because of losing that job actually contributed to her death, and she did die before that case was heard. Before that case was decided, and it did go in our favor, where it explained that the 1960s civil rights laws do cover trans and gay people in the workplace. And so across the country, it is now federal expectation that gay and trans people are not discriminated against. I will say there's 1,000 ways to discriminate against somebody without firing them, so that does not change. People still are unkind and make things untenable for a lot of people. But that Supreme Court decision was huge. I 100% shed tears about it because I really did not think that it was going to go in our favor. The National Center for Trans Equality started doing surveys in 2011 for trans people across the country. So they did one in 2011 and one in 2015, asking trans people about their experience in the world. So I think it's really interesting. If you're interested in the full report, it's available online for free. It's really, really interesting data about what it's like to be trans. I am not personally trans, though I know a lot of trans people. So hearing their own voices and what their own experience is like is really, really important. So in the first study in 2011, actually, there were less than 800 respondents. And by 2015, there were 28,000. So part of that is just that the internet was a bigger thing. And part of that was that people started saying, I need a voice and I need to be heard. And they were less scared to do so. So this covered every state, DC, Guam, Puerto Rico, and all the US military bases. And the most stunning thing that comes out of this report, and it happened in both 2011 and 2015 with very little difference in the percentages, was that 40% of those people had attempted suicide in their lifetime. The national average for attempts and completion suicides is 1.6%. So that's an enormous difference. And again, it's not because there's something wrong with trans people, it's that they have spent their lives being told that they are not who they are. So if someone says, I want to play with dolls, and everyone around them says that's not what boys do, that you do that kind of thing to somebody over and over and over again, and they start to believe that they're not who they are, or that their life has no meaning or worth. And so there's a very high rate of suicide attempt in this group. 33% reported having at least one negative interaction with a healthcare provider, and 23% just didn't seek the healthcare that they needed because they were afraid of being treated poorly or having a healthcare provider that didn't know what they were doing. And 46% of the respondents reported being verbally harassed in the year before. And that goes back to that idea of being stealth or being able to pass. Being verbally harassed on a regular basis really is not a really good quality of life, and it makes it very difficult and very scary. This is a picture of somebody trying to decide which bathroom to use. So this person is going to have to decide whether they're going into the girls' bathroom and to get yelled at because they're in the wrong bathroom, which happens quite a lot, or if they're going to go into the boys' bathroom because that's what they identify as, and they have the risk of getting beaten up. 57% of people in this survey did not feel comfortable asking the police for help, and 59% of just flat out avoided using a public restroom because they were afraid. 32% limited food or drink intake so they wouldn't have to use the bathroom in public, and 8% had a UTI or kidney infection as a result of that. So as we keep moving through this, I really encourage you to be cognizant of how our culture uses gender to elevate people or to suppress them. We do both, sometimes in the same breath. Places like, Target a couple of years ago decided that they were going to stop having gendered toy aisles. So they were just going to put all the toys in the aisle rather than having a boy aisle and a girl toy aisle. And people lost their minds because they thought, how am I going to decide what toy my child should play with if Target doesn't tell me which one my child belongs to? And my answer always is, give the child the toy that the child wants to play with, regardless of what gender it belongs to. Really paying attention to your personal feelings about gender, about your own gender, about other people's gender, and what the medical system does about gender. And pay attention to your own personal experiences in gender and your own trauma, because all of us have trauma of some kind. And realize that there's going to be trauma in the other people as well. So a seemingly innocuous comment might mean something very different to somebody else. And then making sure that you have good boundaries. So just because your best friend is trans doesn't you understand the trans experience, and making sure that you are not using someone else's trans experience to explore your own gender. A good solid conversation is not a bad idea, but it is not incumbent upon trans identified people to educate you or to explain things to you. So bathrooms are always a big topic. Everybody wants to know what's going on with bathrooms. Especially in the last couple of years, we've had a bunch of states who have so-called bathroom laws. They're really transphobic laws, but we call them bathroom laws because they have to do with where people can pee. I spend a lot of time thinking about this stuff, and I sort of thought about, okay, so why are bathrooms segregated male and female in the first place? And the only reason I can come up with is because we don't want male and female genitals to be near each other in a bathroom. And it just so happens that we happen to pee very nearby our genitals. And if we say we had like Spider-Man wrists, and that's where we got rid of our urine, this would be a non-issue, right? We would have non-segregated bathrooms because we'd all just like put our arms up and pee and be done. But because the pee comes out near our genitals, we have to somehow separate the two. And for years, I think that was because either, men were predatory or it was improper for people to see each other's genitals. So now we have lots of people with lots of different sexual orientations. So someone like me, who happens to have a wife and identify as gay, if I go into a girl's bathroom, which is where I have to go because I have a vagina, then am I not a predator? And bathrooms tend not to be the place I want to have sex. It's just my own thing. It's not typically clean, and it's not, especially in public bathrooms. But this idea that we have to segregate the two is kind of outdated. So having gender neutral bathrooms is really important. So my new sort of radical thing that I do is when I go into a restaurant that has single stall bathrooms. So most, restaurants have these very nice bathrooms, just one door, one toilet, and both bathrooms look exactly the same, but one is marked female and one is marked male. I typically say to the restaurant, hey, love your restaurant, food's great. Would you mind considering making these bathrooms gender neutral? Then you don't have a line out of one and everybody can use the bathrooms. Because ultimately, the whole reason that you go to the bathroom is to go to the bathroom. There's a program called I'll Go With You, where people can sign up to have buttons and if you wear that, a trans person who's worried about going to the bathroom, you can escort them to the bathroom so that they're safe. Bathrooms tend to be where a lot of violence happens. In some of the southern states where these laws exist, in Connecticut, we have a law that says that you can use whatever bathroom is correct for your gender identity. So this does not necessarily exist here, but in some of the other states, there are laws that say you must use the bathroom that correlates to your genitals. And they are allowed to check if they want to. How that's not entirely traumatic, I don't know. So someone like me, if I was born with male genitalia, if I look like the way I do and I went into a women's bathroom and someone said, you have a penis, then I could be fined or jailed for that. So again, ultimately, the point of a bathroom is to get rid of waste, not to worry about genitals. The one quote I put up here is really just, a lot of people argue that somehow girls and women are going to be assaulted in bathrooms if men are allowed in the bathroom. And the point is that trans women are not men, they are women. And if you have somebody who's going to dress up as a woman to assault you, you have a problem with predatory men and not trans women. Athletics are the other big thing in the news these days. There's lots of different things going on, from the Olympics all the way down to high school sports. So Connecticut currently has a lawsuit pending. 3 cisgender or non-trans track runners are suing the state because the CIAC, which is the body that makes the laws or the policies for high school sports in Connecticut, has a rule that if you participate in the sports with your gender identity, so if you identify as female, regardless of how you were born at birth, you were assigned at birth, then you are going to play with the girls. And if you identify as male, then you're going to play with the boys. There are rules that you can only identify as one gender in a year. So if you say play volleyball as a girl and then want to play basketball as a boy, you can't do that. You have to maintain a solid gender identity. Most trans people have a solid gender identity, and most people are not changing their gender identity in order to participate in a certain sport. So there's a battle now going on with the federal government saying that because Connecticut has this rule that we're not going to be given our federal funding for those sports because we're violating Title IX, basically arguing that trans athletes competing against their peers violates Title IX. No one is talking about trans men. All they're doing is talking about trans women, because their biggest concern is that people who are assigned male at birth are now competing against people who are assigned female at birth, and that will somehow translate into only trans athletes winning. In reality, there's a very low number of people who identify as transgender in athletics. In the NCAA, across the country, there are 200,000 female athletes and only 50 of them identify as transgender. So there are different rules at all different levels. I played sports my entire life. They were a lifesaver for me. They made a huge difference in how I survived adolescence. And sports are incredibly important, not just for cisgender people, but also for transgender people. And this idea that they should either have to participate in sports a different way. Say a lot of people want to segregate them out into their own sort of group, or that they have to participate with their sex assigned at birth. None of those make sense. It just means that trans people are not going to be active and not going to participate. And then just a couple of quick slides about what it means to be dysphoric about when you're transgender. So people who identify as masculine, the complaints are typically that their voice pitch is too high. They have chest tissues. So these were people born with female genitalia. And so if they've been through puberty without any kind of blocker, they typically develop those secondary sex characteristics that are associated with estrogen. So higher voice pitch, presence of chest tissue, having a period. I always say, having a period is not the most fun thing that any of us have ever done. And if you believe that you're male and your identity is male and then you have a period, that's very dysphoria inducing for a lot of people. The lack of facial hair and the shorter stature. So the answer is that we give these people testosterone and try to reverse some of those secondary sex characteristics. We're able to decrease their voice pitch. Chest tissue isn't really affected, but we can do surgical procedures to make that more aligned with their gender. We can often stop menstruation by giving them testosterone. We can help them grow facial hair. Can't usually do much about stature if we're starting after puberty. Some people do identify as non-binary on the masculine spectrum. So sometimes we're doing either short courses of testosterone to get outward effects and then we stop, or we're doing low doses or microdosing. Many trans masculine people bind, meaning that they take either ACE bandages or binders to suppress their chest tissue so that they're not presenting, because when someone genders you without knowing you, they look at your face, your hands, and your chest. And so if there's visible chest tissue there, even if the rest of them looks masculine, they will change, the person will gender you differently. So binding is very common. For people who identify as female, the lack of breast tissue is often dysphoria inducing. The lower voice pitch, the facial hair and bone structure, any balding that they've experienced because of the presence of testosterone, elevated stature, and any unwanted erections. So if you identify as female and you're having erections that you're not controlling, then that's often dysphoria inducing. And we use estrogen or testosterone blockers or a combination of both to help with those issues. Many trans women have breast augmentation, and some also go on to have vaginoplasty. And then some people are non-binary on the feminine spectrum, and so we do microdosing on that spectrum as well. So, a lot of the things that I talk about in these lectures can be really sort of heavy and not give us a ton of hope, but I did want to share some of the more positive data that came out of this national study. And this is the impact of family acceptance. So in the dark blue bars, those are people whose families were accepting and helped them through this process and understanding their gender identity. And then the lighter blue bars, people whose families were rejecting their gender identity. And so rates of homelessness, incarceration, doing sex work for income, attempting suicide, and even smoking and drug and alcohol use, all were improved when the family was accepting. And this is across multiple different studies. We see it both in children and adults, where if the family is accepting, the outcomes are significantly better. So in your own environment, in your home, in your office, have to sort of look at how things are set up and what kind of signs that you have that you're accepting of people who are gender expansive. So having visible signs, safety zones, the trans flag, the pride flag, having gender neutral bathrooms. In the hospital, we do rooming. So in Connecticut, everyone is roomed according to their gender identity. And then basic competency for everyone around you. Anybody who's answering phones, anybody who's registering, for us, even security and volunteers. And then Pride events are really, really fun and exciting. I was really sad that all the Pride events had to be canceled this year, but hopefully by next year we'll be back to it. So Pride Month for gay, lesbian, and transgender people is in June. In November, on November 20th every year, we do Trans Day of Remembrance, which is a remembrance of those who have been lost to either suicide or violence in the United States and across the world. It's really, really powerful. At Middlesex, we're going to be joining with with MCC in Hartford, which is a church that Reverend Aaron Miller runs a TDOR service every year. So we'll be joining with him to do that this year. I will say it is a time of year where you read all of the names of the people who have died. And it is incredibly sad, but also very motivating to get back out there and to do the work to make sure that people are accepted and that we're not unnecessarily putting violence on other people. And then in March is the Trans Day of Visibility, just encouraging people to be out and talking about it. Not all trans people are going to be comfortable talking about their gender identity on a stage, but for some people, they feel like that's a way to improve the lives of others. And then I just put a couple of things here. There's a great sort of little clip on YouTube from Madam Secretary, where one of the characters talks about being non-binary and what that's like. And so it's just an easy way to sort of see it and hear it and experience it in a different way if you haven't yourself. The ACLU documentary is just fantastic. I highly recommend you watch it. It's about 20 minutes and it's about a little girl in Texas. You may have seen her on the news. Her mom was actually a Christian conservative who did not believe in anyone being transgender, and then sort of realized that her daughter, she had a choice between a dead son or a happy daughter. And so she did her research and got her work done. And it's really just hearing the kids' experience and the mom's experience. It's really, really, really powerful. The soldier one is just a short clip about a soldier coming home from being deployed and their child being a different gender expression than when they left. And there's virtually no words, and it is incredibly powerful. And then if you're interested in the healthcare part of it, the UCSF Transgender Care Program, the website is there. All the guidelines that we follow are on there. It's very easy to read. It's very accessible for both medical and non-medical people, and very interesting information about what we do in terms of hormone therapy. And then the last thing that I always put up in almost all my talks is this slide, because I really do feel, especially, I love what I do and I'm confident in what I do, but every single day, I try to get out of my comfort zone to make sure that we can make the magic happen, because the ways that we learn really matter. And it's when you're uncomfortable is when you got to do the work. So that's what I have. I'll check the chat, and Lindsay, you can tell me if there's anybody that has questions already.
We don't have any questions just yet, but one of the participants shared that New Haven Pride is having one day on October 10th.
Great.
So if anyone has any questions or comments, please feel free to add that into the chat right now. We still have about 15 more minutes, so she's all yours. I guess one thing that I learned from this, as people are sort of writing in their thoughts, is that I really liked how you described the gender versus sexual orientation sort of thought process, and that's a really good way that I didn't have the mix before, but how you explained it made it much clearer to separate the two. And if it does come up a conversation, a much better way to share and explain to others that it's easy to understand.
Yeah, it's a very interesting thing. You know, it really just goes back to vocabulary. And there are people who are gay and people who are trans who don't realize that what they're talking about is actually the other thing. So we have had people, you know, coming in, you know, they go into therapy because they think they're gay, and they come out of therapy realizing they're trans because they did not realize that what they were feeling was something totally different. So it's really, it's an interesting experience. And all of it really goes to us needing labels, right? It's the stereotype thing. We're going to put you in your box and you got to stay there. So, but they are two very different things, and sometimes they are completely different.
Yeah. So as we got one participant was wondering about medical resources for trans teens. If you had any suggestions, or
So there are. Sorry, you're going to see a weird screen for a second, so I can get those links. For trans teens, the Trans Care site at UCF will have information as well. WPATH does have information. And the Endocrine Society has some as well. And I'll put these in the chat for you.
Jessica said that they find your jokes funny, and thank you for a very comprehensive overview.
I'm glad you find my jokes funny. I find them funny, and then I laugh at myself. That's usually what happens. I had to record a 3-hour lecture for the American Association of Nurse Practitioners, and I literally sat here at this table and laughed at myself for 3 hours. Let's see how that goes.
Did it go by fast, or was it a long 3 hours?
That was a long 3 hours. I broke it up into 1-hour groups, but by the third one, I was like, I don't know if I can hear myself talk anymore.
All right, so any other questions we have? Now's the time. So let's see. Do you want to mention the advocate groups such as Trans Pact and PFLAG?
So the PFLAG is awesome. True Colors is also a good place for teens to get information. There's lots of great programs there. True Colors also does a program once a year for trans and gay youth, usually in March. And I think this year they canceled this year, and I think next year they're going to do it virtually, just because we're so much unknowns about next year. It is the largest gathering of trans youth in the country. It's awesome. So it's really sad that we can't do it in person this year, but I'm sure it'll be back. And then Middlesex, actually, if you go to the Middlesex Health Transgender website, if you just Google that, it comes right up. We have online support groups now as well. We have one for allies. We have one for trans feminine people, trans masculine people, and we're also doing a college stage one because a lot of college age kids are now back home living with their parents and not always in the best of situations. So we have all those online, and they're run by our mental health team. Our Angel Ruben and Jesse Byers are phenomenal and run really good programs. So those are there as well.
Great, thanks. So it's a good thing we recorded tonight because a couple of people want to share it with the organizations and their families. So that'll be great once we get up on our channel. Share your message far and wide. Any other questions? Any other comments you want to share with the others? Okay, that might be it then. Thank you very much, Katie.
Thank you very much, everyone.
Thank you for doing this fantabulous